and what is the immediate implant placement. So as I said, I have to take a CBCT, and let's say it's a front tooth. Oh my God, the patient is now scared because how am I gonna, and I've had these so many times, what am I gonna do? I can't walk like this, I can't go to work without a front tooth. So if the tooth needs to be removed, I check the measurements, and then if we have good bone surrounding it, we can pull the root, we can place the implant, then we put bone around it, then we put a little membrane on top of it, and then usually I would put like an extra tooth, like a fake tooth, kind of attach it to the two teeth on the side, or we can make like a little, I wouldn't use a flipper, but we can do like an Essex retainer with a little tooth in there. And then the patient leaves with, teeth, a smile. Of course, you're not gonna bite on this until we are completely finished, but at least you have a tooth. So once the implant is in, we before I even am completely done, we stitch and close. And now there are different kinds of implants. So there is the implant that goes in the bone, all the way down in the bone, which is called endosteal, like it's all the way in. Then there is the subperiosteal, which is like a tiny little bit on top of the bone if you don't have good enough bone, or you don't want to go deeper, and then you might hit any of the vital structures. And then there is the zygomatic. The zygomatic, it goes all the way in back here in the zygoma if you don't have enough bone structure on the top here. Once this is done, we stitch and we take another 3-dimensional x-ray to make sure completely that the position looks good, the bone looks good, we are away from, just to kind of, after you do the work, you take a post-op, you have to make sure everything looks fantastic and that you are away from any major structures.